Hello, I'm Cameron Walker and you're watching a special edition of GBN Royal, and welcome to the Oasis Health and Wellbeing Centre and Garden here at the Royal Berkshire Hospital. Now, I've been covering Prince William's engagements here on behalf of the Rota. He is joint patron I should say, along with his wife, the Princess of Wales, of NHS Charities Together, who following the start of the coronavirus pandemic in March 2020 had raised more than £160 million for the NHS across the country, supporting staff members and their well-being. And part of that funding went into refurbishing this place at the Royal Berkshire Hospital. So 5 years on since the pandemic, it is now a haven for NHS staff to come here following or during grueling shifts in the hospital opposite on the other side of the road, to come here and just reflect, decompress and unwind, which does, surveys and data suggests, have a very positive effect on their mental health and well-being. In fact, the Royal Berkshire Hospital is one of the best in the country for staff retention, but also the positive mental health of staff members. And Prince William, from observing him for an hour or so, was really trying to emphasise the fact that NHS staff sometimes should put themselves first and their mental health first, as well as, of course, looking after patients, but taking a moment for themselves in a place such as this. So here's a little bit of a highlight of Prince William's visit earlier today.
5 years ago, the NHS was dealing with arguably the biggest crisis in its history. The Prince and Princess of Wales became joint patrons of NHS Charities Together to support the well-being of staff dealing with death almost daily.
A lot of people felt powerless at the time because we were coming to work, we didn't know how it was going to be like, we didn't know what was going to happen, and that really had an impact on everyone. People were concerned about their personal life, the personal health.
And you made quite a tough decision to not return to your home country of Italy to see your family for almost 3 years. You were telling the Prince. Yeah,
so it was a tough decision, but I felt it was the right decision at the time because I had to make sure that my family was safe. So traveling wasn't the right choice at the time. So I made sure that I wasn't traveling until it was safe to do so. And then also it wasn't the right decision for the staff and the patient here as well, because I needed to travel, then isolate. That means that I was gonna be losing time that I could give to the patient to provide care to them. It was a tough decision. I don't regret it. No, I think it was the right decision to be done at the time, and probably I will still do it again if it comes again.
And this Wellbeing Centre here has obviously been set up post-pandemic. So compared to, in terms of mental health support when you were working those relentless shifts during the coronavirus pandemic, during lockdown, to a shift now, let's say, what are the differences?
I think there's a lot more focus on mental health and well-being, especially after COVID. We have seen now, obviously, we've got this amazing building where there's a lot of focus on staff mental health and well-being. That we've got activity with the psychologist, there's session available, we've got yoga sessions. So there's a lot more now available for staff to debrief. If you have a difficult shift, we arrange trim sessions or decompression session, or even if you got difficult time, like you just had a very difficult meeting, that you got these health and well-being center where you can come and just relax your mind, that you can spend your break here enjoying the sun, talking to other people, and that's something that it really helps the staff to kind of get away a little bit from the busy department that we got here in the trust, and that's something that staff is really grateful for.
And have you noticed a difference between yourself and also your colleagues in terms of being happier or more motivated?
Definitely, we've seen that, and we got the result of the staff survey. So the results are just showing that what we're doing for the staff had an impact on them, and they're more grateful of what we do. Our results are quite good. We're waiting for the 2024 results to come out shortly, but definitely we've seen that our vacancy rate is also gone slightly better. So we've got more people that decide to stay within the trust, and that means that what we're doing to protect them and to make sure that they stay with us is working. And that really helps our staff because having a shift where short helps everyone, and then also helps our patient to receive the outstanding care. To think about that, it's been 5 years.
That was Sergio Tomelio, a lead nurse who didn't see his family for 3 years to protect patients.
And we have learned a lot from that.
These are our two memorial trees too.
The pandemic hits the Royal Berkshire year hard. The first patient to die of COVID-19 in the country died here in March 2020. The Prince wanted to also remember the members of staff who lost their lives. He paid tribute to Dr. Peter Tunn and nurse Julie Edward, 2 trees planted in their memory. But he was also here to spotlight something positive. Some of the £160 million from NHS Charities Together, raised during the pandemic, paid for the refurbishment of the Oasis Health and Wellbeing Centre and Garden. Something Holly Coles, COVID vaccination service lead, says is key.
Having a dedicated centre that the staff are able to use to relax, to do exercise and to have a space as their own that they can take out from their usual day is really important, as well as focusing on the health of as well in terms of the gym facilities as well.
How did COVID affect staff health and wellbeing?
So I think it helped. It definitely had an adverse effect on their health and wellbeing. Everybody was very, very busy during the COVID pandemic, as I'm sure you can imagine. But having somewhere where we can all come together and be able to have that sort of reflection time is really important. As you can see from the gardens here, reflection is definitely central in the garden as well. And having dedicated staff to be able to do that too, to look after occupational health and wellbeing.
And having come out the other side of the pandemic, lots of vaccinations. You mentioned 50,000 have been done here at the Royal Berkshire Hospital. What kind of vaccinations do you carry out now in the more permanent facility you have?
So we still carry out with the COVID vaccination seasonally when they are recommended. We do the flu vaccinations as well, and we also do some year-round vaccinations in terms of whooping cough, RSV, which is the new one in pregnancy, and we also roll out doing inpatient vaccinations as well as part of their discharge planning, which is really important for the most vulnerable patients that we're discharging into the community or to care home.
Unless there's almost enforced breaks in someone's career, as part of your career development, we're never going to get to the point where we can really look after people's mental health, because you always rely on an individual to put their hand up. And if we always rely on an individual to put their hand up, we go round and round the same problem over and again.
Prince William there talking about the importance of staff looking after their own mental health, particularly in gardens such as this. But sometimes that is a challenge for NHS staff with their gruelling shifts. These enforced mental health breaks, which Prince William speaks of, can be hard to come by, staff tell me.
Yeah, it's definitely a challenge. So most clinical staff in particular get a 30-minute break, and one of my key messages championing for the health and wellbeing is to make sure that we actually look after ourselves. It's all too easy to put patient care first and actually forget about caring for the carer, and that's a message that we really champion across the organisation. Having a building such as the Oasis is a real incentive for staff to come away.
Sorry, I know you're probably chilly, so waiting around.
The Prince spent time talking to frontline NHS staff to hear how the centre helps them decompress after long and challenging shifts. Data shows the Royal Berkshire Hospital is one of the best in the country for staff wellbeing and, crucially, staff retention. But the Oasis Centre the Prince visited today is the exception, not the norm. The NHS as a whole is struggling to recruit and retain staff with low morale levels.
Work in the garden?
The challenge is replicating a service like this nationwide. 5 years on from a time we thanked NHS staff by banging pots and pans on our doorsteps. Cameron Walker, GB News in Reading.
Well, as you saw from my piece there, the Prince of Wales really wanted to pay tributes to Dr. Peter Tunn and nurse Julie Edward. They are the 2 members of staff at the Royal Berkshire Hospital who lost their lives to coronavirus during the pandemic. Thank you so much for watching. Don't forget to like, subscribe and comment. This has been Cameron Walker for GBN Royal.